Hi, this is Travis here at Exercise Lab with another video for you guys. I'm a doctor of physical therapy for those of you who don't know me, and I'm down on the floor today because I'm going to be talking about foam rolling. I've uploaded a foam rolling video kind of in the earlier days of Exercise Lab, but I realized it leaves a little bit to be desired, not the least of which because the audio quality wasn't that good. That was just kind of in my old apartment I was living in, so luckily now the audio is hopefully a little bit better. But I'll also be talking about just kind of what's evolved about foam rolling. What are we thinking about today? Who's it really going to benefit? And, what are some of the options out there? Obviously, your standard 6-inch diameter, 36-inch length roll is, I'd say, probably your bread and butter roll. But there's some other options out there, so I'll be discussing some of those as well. And just kind of the overall thoughts on, performance enhancement, pain, who's going to be a good candidate for foam rolling, and my 2 cents there. So if you're interested in learning a little bit more about that stuff, go ahead and stay tuned, and we'll get started. Okay, so if we're going to start in the simplest position with foam rolling, and I should also probably talk about, first of all, who's a good candidate for foam rolling. If you're somebody who has very low muscle mass, very, kind of more bony, or you have a lot of bony prominences on your body. If you have osteopenia, osteoporosis, you're at a bit of a higher fracture risk. If you're somebody who's had, obviously any open wounds, a lot of skin, issues, skin integrity issues, cellulitis, those types of things, foam rolling may not be a good idea for you. So I'm going to be talking to somebody who hopefully doesn't have any of those things. That being said, I'm not saying that you can't be, somewhat elderly. I've put people who are, on the frailer end of the spectrum, so to speak, on foam rolling with a few different subtle modifications, I should say. I might not go for the densest roll either, and that's one thing you should think about with foam rolling. The black ones in general tend to be denser. It's not standardized by any means, but typically when you see the foam rollers that are like white or pink, those are ones tend to be a little softer. Sometimes the grays, obviously test it out. I would probably start out by not just putting your full body weight on it too, and I'll be talking a little bit about that as I go through the rolls. So all those caveats being said, I'm going to start on the roller in just a seated position. I'm just sitting on this thing like it's a chair, okay? And then from there, the easiest thing to think about rolling would be my glutes. So I could drop my hands back a little bit, and I could just do kind of a very generic roll of my glutes. I'm just kind of going back and forth, okay? So if I was somebody who, for whatever reason, I had a lot of tension there, either for, because I was exercising in a certain way or they just feel tight. Now you might notice I'm going to shimmy a little bit side to side as well. So I can kind of bias a little bit getting into that, glute me, glute min area. I can come around even a little bit more, maybe even into the, TFL. I'm getting kind of close to that now, which is a muscle kind of right between my hip bone and basically my iliac crest, which is the upper part of my pelvis. And so I'm just kind of exploring the terrain, no particular rhyme or reason. Fortunately, I don't have any real issues in these departments right now, so I'm not necessarily trying to hone in on an area, but if something felt particularly tight and, like it needed to be worked out, I could certainly spend a little bit more time there. People who have SI joint pain, sometimes you might find some tenderness there in some certain spots. And again, for the people that are bonier, that may also just be because you're right on the bony kind of protuberances. So I would say that if, it's more muscular, kind of that more massage type feeling, that's what you're ideally going for. So now I'm kind of at the top of the sacrum. I'm definitely not in my lumbar spine yet, and I'll be talking about how to go there in a moment. But, I just kind of go side to side, and, no particular rhyme or reason. This is just a very kind of generic, broad way to roll the glutes. Now, if I wanted to, put a little bit of tension on that glute, I can go into sort of a figure 4 position, bend my opposite knee, and then I'm basically using my opposite arm and leg to just navigate around this roller, okay? And I can decide, again, how high or how low I want to be, okay? Again, I can kind of come in here. And so the idea is I'm stretching my gluteal fibers now, particularly on my glute max. So really get in here, again, pure firmest area. If you're somebody who has a lot of sciatica and you're noticing increased, symptoms, increased numbness, tingling, buzzing, pain, shooting down your leg, then I would say obviously you want to tread carefully there. You shouldn't be feeling an increase in your symptoms. Mostly just kind of that, we call it hurt so good massage type feeling. Some people actually notice their symptoms may diminish a bit as you're doing the rolling, and if that's the case, then great. If you're not getting there though, then obviously I'd say you don't want to fan the flames, because nerves can be kind of finicky. They don't like to be stretched or pinched or pulled on too much, and so if you're getting a real increase in your symptoms, particularly as it goes farther down into the foot, that's generally a bad sign. If you're noticing you're somebody who has symptoms maybe in the foot or the calf, and they're kind of working their way up higher, sometimes that can be a good sign. We call that centralization. But when in doubt, if you're not really clear what's what, you certainly want to get linked up with a healthcare professional who can help you sort that out. So, when in doubt, I always say get checked out. Okay, so that's rolling the glutes 101 there. Okay, so I'm going to get to the low back in a minute, kind of working my way up from the glutes. But before I go there, I'm going to go actually down to the side of the thigh. IT band, quadricep, essentially, this musculature area. IT band is just a big sheet of fascia that essentially runs from this muscle that lives up here called your TFL, which is a hip flexor and abductor, meaning it turns, it lifts your hip and goes out to the side. And it connects this big sheet of fascia that pretty much runs down to the side of the knee here, okay? And a lot of people can, will feel some tenderness in this roll, particularly if you haven't done it before. So if it's so intense, you need to bite down on something, tread carefully. What I would say here is you're not going to want to probably put your leg stacked right away if that's the case. I'll take that top leg and I'll just drop it off in front. And then all I'm going to do is just drag my body. I'll move down here so you can kind of see what's happening. I'm just going to drag my leg. I'm going to put my leg back just so you can see what's happening. I'm just dragging my leg just to where I get, right above the knee. I don't necessarily go right on the knee itself because that's just going to be uncomfortable. I definitely don't go on the knee cap. And so I'm not actively trying to flex and tense my muscle. I'm just trying to keep it nice and heavy on the roller, relaxed. And I just kind of roll. Again, this would be just purely on the side. Now, if I was putting my foot in front the way I normally would, I can also start to get into the quadricep, sort of that outer part of the quadricep we call your vastus lateralis. So that's kind of where I am now. And then getting into that rectus femoris, which is one of the quadricep heads that runs right in the middle there. Okay. Sometimes I'll even drop that leg off. This would be a way to kind of get into the just kind of broad quadricep area. I can then move that roller up a little bit higher. So I'll show on this side. I can get right into that hip flexor region, okay? Dropping my body off and just kind of rolling that hip flexor, okay? Sometimes for people, if that's really a tight area, you can just kind of keep your knee down and almost do some little leg curls there, just to kind of, a little mobilization with movement, so to speak, as they call it. And I'm just kind of feeling out that terrain. Again, I could come around here in the TFL if that was where I was feeling some tension. I'm just kind of, again, it's like a self-exploration exercise. Just kind of going through and trying to identify wherever some of your spots might be. Hopefully and ideally, you'll be getting yourself to a point where you can go through all these rolls and it just feels like what I like to call butter, meaning maybe it's not so soft as like butter, but you're basically going through it in a way that it feels like a little bit of muscle tension, maybe kind of a, moderate massage at most. But there's nothing you're really identifying along the way where you're like, that's the spot, or, you're not really wanting to bite down on something. You just want to go through those rolls and feel like, okay, that feels pretty good. It feels pretty loose all around. Nothing, no real major issues there. So I like to generally get people to that level. Once they're at that level, then I'll tend to back off the frequency, typically in what I call maintenance mode, meaning you're just doing this periodically. Because I don't necessarily think you have to do this stuff all the time, again, unless you're working through particular issues, which I'll talk about in the end of the video. But that's basically how to roll your thigh, outer thigh part, which we tend to call the IT band. Okay, so working my way down the thighs now. Next thing I run into are the legs, essentially the calves, right? And just some good old-fashioned calf rolling here. Again, this would be the most kind of generic way to do it. I'm just basically trying to keep the weight of the calf nice and heavy on the roller. Now, this one does take a little bit of upper body strength because I'm, kind of basically doing almost like a seated dip in a way as I'm kind of navigating this. If that's hard for you, though, obviously you can keep your hips down. You just have to kind of do it, piecewise, where you're maybe kind of, scooching on your bum a little bit. If you need a little more pressure, which many people will because there's not a lot of weight there, it's pretty much just the weight of, my lower leg and my foot. Sometimes draping one leg on top can allow you to get a little more pressure. And so, again, it's not about masochism here. I wouldn't always say you need extremely deep pressure, but sometimes you can get into some areas with deep pressure that you're not going to necessarily feel as much. You're just going to kind of blow past with moderate pressure, and you're like, oh, actually, what? I do feel a little more tightness there on the outside of that, gastroc or calf muscle compared to when I put deep pressure over here. It's not too bad. So that maybe allows you to identify some different areas that maybe need a little bit more time and attention. One cool thing about calf rolling, there was a small study that was done, I believe primarily on women, that basically showed you can increase what we call dorsiflexion range of motion, which is your ability to essentially lift your toe up toward your chin. Plantar flexion is what you think about as, going up on your tiptoes. Dorsiflexion is going the opposite direction. And that's actually pretty impressive because dorsiflexion range of motion is a stubborn one. Sometimes it's going to be a harder thing to get back when you've lost it, say after an ankle injury, or just as you're getting older. A lot of people like to have tight sheets in their bed. Their ankles kind of get stiff this way. Certainly people who've been hospitalized for a while, if they're not wearing these things called Prefo boots, and their ankles get kind of stiff. So knowing that you can increase range of motion by just doing this, not even necessarily doing, more conventional, type of either manual work or stretching, It's pretty powerful, I think, and that's a pretty cool thing. And I think it actually was maintained for a little while, if I'm not mistaken, after the rolling. They think they called chronic after like 7 days, which is not really a long time. But it just speaks to the fact that you can, accomplish some increases in flexibility, mobility with foam rolling alone, which I thought was a pretty cool finding. Probably by increasing tissue temperature and things of that nature, maybe a little bit of elasticity. And we do think, there may be some ability, which I'll talk a little bit more about at the end of the video, decreasing pain, tenderness to pressure, essentially. Sort of you get desensitized to it when you're doing foam rolling. So that's one reason why you might want to try to roll the calves. People who have decreased dorsiflexion, which again is that ability there, can also definitely have issues with their balance sometimes, because if you're not clearing your toe very well as you're walking, you tend to catch your toe more sometimes, and catching your toe obviously can lead to loss of balance and things of that issue. So that does become increasingly important as you age. If you're somebody who has the flexibility and mobility to do this, and that's the one caveat though, is if you're somebody who has all those issues, well, you may not be strong enough to get in these positions, but hopefully if you can build up to that level, this can be a good thing to add to the mixture. And from there, it kind of naturally follows, goes without saying, if I wanted to roll my hamstrings, same thing. I should have probably talked about this when I did the glutes, but I can certainly roll my hamstrings in very much the same way. I'm just pivoting my body over the hamstring. Again, hard to get a lot of pressure here. Sometimes what I'll do is I'll do that draping thing, and from there, I can kind of bias a little bit of that outer part of the hamstring, which we call the bicep femoris. If I want to get into that area a little bit, sometimes people can get some tension there and just try to navigate the terrain. Now, if you're fortunate enough to have something like I do here, a Smith machine, sometimes you can use a bar to hold on to. So sometimes I'll go into here and I'll kind of hold on to a bar as I'm doing this, just to kind of help with the navigating over the roller. So if that's available to you, that's a pretty cool way to do it. If you're just down on the mat though, then no harm done with just kind of using your hands to move around, as long as you have the strength to do that. But that's how you increase hamstring flexibility a little bit. And so similar to the calves, there was a small study, I believe, as well, that did show hamstring flexibility increase somewhat with foam rolling. I think that might have been a protocol that lasted about 4-ish weeks or so, something in that around the age of 4 to 6 weeks. And I think these people did it. I want to say, I'll have to look back actually. It was a few minutes, I believe, of foam rolling, and I want to say it was 2 or a couple times a week. So again, I wouldn't get too granular about this because those protocols are far from perfect. I would say in general, if you're somebody who has really tight hamstrings, tight hamstrings can sometimes be kind of a misnomer though, because actually the reason you feel your tightness there is because you have glute weakness. So there's sometimes going to be other issues going on with hamstring tightness. But if you're somebody who does know and has identified you need to increase hamstring length, initially I would say probably the more frequently you can do it, the better. Obviously not doing it like 20 times a day, but if you could do it once or twice a day for a few days, just kind of get over the hump initially, and then maybe do it every other day after that. And then once you feel like you're starting to increase mobility, then you just kind of gradually back off that frequency. I think that's a pretty good rule of thumb for increasing hamstring flexibility. Okay, so last rule I want to talk about in the lower half, legs, thighs department, is going to be the adductors, which are essentially the inner thigh muscles, the thigh master, squeeze the knees together muscles. Simple way to get after those. A lot of people have tension in this area that don't even realize it, is to just bend your knee and just kind of navigate this way. Again, I can move the roller out closer to the knee, and generally as I do that, it's going to get more tender. And so I just kind of roll around, again, just feeling out wherever I have issues. If I want to move away, you can do this with a straight leg as well. Versus a bent knee, you'll tend to put a little bit less, you're gonna put a little more slack on that adductor muscle, and for that reason, it'll probably be a little bit less tender initially. So sometimes I tell people to start, this way. If you want to even drape that foot up behind to really cut yourself some slack, that's fine. Maybe again progressing to here, and then eventually progressing to where you can do this with a straight knee. But that's a pretty good roll to work the adductors, which definitely can uncover some hidden spots for a lot of people. It's one of the more what I like to call and joke around, masochistic rolls. Similar to the IT band, it tends to be a tender one in the beginning. But again, usually once you've sort of gotten familiar with it by doing it a few times, you won't feel as much of that tension. But again, if you're really biting down on something in the beginning, or feeling like you need to, just back it off a little bit. Try the bent knee versions, and then just progress up accordingly. Okay, so now I'm going to talk a little more about the upper half. All the other stuff was for lower half, so now we're getting an upper half. Low back is a great roll, and the hard thing about doing it when you don't have something to hold on to is your abs just have to work super hard. So if I'm down in this low back vicinity, it's almost like I'm doing a static crunch, and so my abs are really having to work hard to support me in that position. I can keep my hips down on the floor, and I can kind of try to roll there, but it's just kind of awkward and hard. You can kind of shimmy a little bit side to side. I would say tread a little carefully though when you're kind of down in that low back vicinity, because you're going to start getting close to your 12th and 11th ribs, which your last two ribs are what we call floating ribs, meaning they don't come around to the front and attach to your sternum. And so those are probably a little bit easier to dislocate if you're putting the whole pressure of your body on those areas. So I tend to tell people, kind of feel about where the bottom-ish of your ribs are and work from there up for the middle part of your back. That's what we call your thoracic spine. The reason it's called your thoracic spine is because those vertebrae essentially attach to your thorax, which are your ribs. And from there, I just tell people, cradle your head in your hands, and you can just do some, good old-fashioned, mid-back rolling, increasing that, thoracolumbar fascia and things of that nature. Extensibility, flexibility. Again, you can decide kind of where you need it. You can certainly bias, one side. Sometimes I'll start to get into that outer lat terrain as I'm doing this. When you're doing that roll and I spread my elbows apart, that's going to bring my shoulder blades together, so I get more of that terrain on top of the shoulder blades, versus if I were to bring my elbows closer together, cradling my head like this, then all of a sudden I'm spreading my shoulder blades apart, so I can get more of those, paraspinals and some of that musculature in between the shoulder blades. So sometimes you might want to do that as well. And again, for the most part, I just usually tell people kind of keep your gaze up at the ceiling somewhere in that neck of the woods. I can even get here in kind of those upper thoracic levels and see how I'm kind of pivoting my body. And that can be a nice way to do that. Now for the low back itself, because I was saying you have to work really hard, abdominal wise to be there. If you have something to hold on to, like a bar like on a Smith machine, now the cool thing is I can get right into that low back area, and I'm lower than those last two ribs, so I'm not really in danger here of dislocating my my lower two last two ribs. But this is just a really nice way to get into, a lot of people who have low back pain or low back issues feel a lot of tension kind of in the QL area, which is sort of on the outside of the low back, getting, kind of as it starts to kind of wrap around the pelvis. A lot of people feel tension in the lower lumbar paraspinals. So I'm basically getting right into that musculature in a way, and again, I'm just pivoting side to side for demonstration. Certainly if one side is a little tighter than the other, I could stay over there for a while. If a spot, and that's a good point I should bring up, if a spot's ever really killing you, like for whatever reason, if I had sometimes we call them trigger points, a spot that really felt like, wow, that's the spot that's really tender, sometimes just holding it there, taking some deep breaths through your belly. And there's things you can read about called box breathing, and maybe I'll get into that at some point. Just some good old fashioned what we call diaphragmatic breaths. So as I inhale, you sort of feel your belly inflate with air. The reason why is because your diaphragm is descending and it's kind of pushing your abdominal organs out. That's why you feel your stomach's not actually inflating with air, as people sometimes try to say. But the point is, basically, you want to take belly breaths because that will kind of quiet your muscles, so you're not fighting against it. Because sometimes if something is really intense, then your muscles are almost going in like a spasm and they're kind of guarding, and you're not relaxing into it. You're probably not going to get what you want out of it. So just try to see if you can relax yourself. Sometimes I'll tell people to do some real small oscillations, maybe if you want, as you're there. Okay. And then maybe move on to another, body part, come back to it again, give it a double dose. And sometimes that can be a nice way to free something up if there's an area that's really grabbing. So again, this roller, again, is 36 inches long, and this is a 6-inch diameter roll, very generic. This is sort of my bread and butter roll. When someone's at a point where they've kind of graduated from this, or they're just very familiar with it, they're at a point where they're like, this roll is pretty easy for me, and I feel like I need a little more pressure. Someone who's maybe pretty in tune with their body, they've got massage a lot, they sort of know that, deep pressure is something that's helpful for me, and this one's not quite tapping into it. I'm not a fan of like some of those rumble rollers, or the ones that have really jagged, kind of ridges on them. But this roller here, I think, is actually a pretty cool roll. I'll put the link to it at the bottom. And I like this because I can really get on those, lumbar paraspinals in a way that I think is pretty advantageous. And so I'll do the same thing with this roller, trying to line. So basically, I'm trying to put my spine in this little groove here. So I'll throw this guy back there, and I'll do the same thing, okay? And if I was going to do my mid-back, I obviously wouldn't need to hold on necessarily to the bar. But if I was going to, sometimes I have to push this thing down. I'm just kind of shimming it, SI joint pain too. Sometimes if you're really tender back in that area, having this kind of more circular rounded area can just allow you to get into something a little differently. You kind of have to feel it to know what I'm talking about. But sometimes you're going to blow past something that with this roll you can kind of get into a little bit more, and then it's like, well, it really gives you some relief. Luckily, in my case right now, I'm not really dealing with any of those issues, as I mentioned, but I have dealt with a number of issues over the years, and so sometimes, having a roller like this is a pretty handy thing that allows you to tap into an area and get some relief, some release, so to speak, that maybe you couldn't quite get with a roll like this. And then similar to that, this is 6 inch again, I believe. This is a 5-inch little ball here. This is called the mobility sphere. I don't get paid by them. I just think this is a cool product. So I'll put the link to this at the bottom as well. Sometimes in the glutes, this can be a pretty cool product that I'm basically, going to be able to get into, and I'll, do that same type of configuration where I'm in that figure 4. And sometimes having a little ball to just kind of work around that musculature can be a nice thing, and allow you, again, to get in some spots that maybe the broad roller there you couldn't quite delve into. And once again, this isn't supposed to be a masochistic thing where you're trying to get to a point where it feels really intense. You're just trying to explore the terrain and maybe see if there's something that feels like it needs to let go that you can't quite tap into, again, with that broad roller. So this is a cool tool that I'll sometimes throw into the mixture. And this little ball works really nice on the pecs as well. All right, so pretty much the last roll I'm going to show you guys today is just a good old-fashioned pec roll. So the pec, toral muscles, or the muscles in the front of the chest here, kind of that anterior deltoid space. I'll often put this roll kind of a little bit of a diagonal like this, and then I'll just take those pec fibers and I'll just try to run them, right on top of that roller. And so now this arm is basically trying to stay nice and heavy on the mat. Okay. Sometimes I can even get in my bicep here, which is nice, if you have a lot of bicep tension there. I'll just kind of work that terrain. Again, you can play around with this angle. So you see how I move the bottom out versus putting it a little bit more kind of in parallel with my spine, just to try to explore the terrain and see where I might need it. Again, if I have a pec that's kind of tight, and I'll come up here, try to just see if I can explore that terrain generally. I can sort of do the similar thing with my lats. If I were to come in here, I can kind of get that rear, or that posterior deltoid, as they tend to call it. I can also kind of get my lats, at an angle like this. All right. Now this broad roller, again, is a great way to just kind of generally cover those pecs. But if, again, I feel like there's something in there that maybe I'm not quite working out with this thing, then that's when I bring in maybe this mobility sphere, put that guy in there, which is going to be a little hard to visualize from this angle, but you get the idea. I can even put my hand behind my back just to kind of try and pre-stretch those fibers and work this out. Okay. Some people will tend to use a lacrosse ball for this stuff. That can work too. Lacrosse ball, the problem is it's a little small sometimes. The density is pretty high, and sometimes I don't know that you necessarily need that really focal pressure. I think if you can just generally roll over with this thing and it feels pretty good, fairly loose overall, I feel like that's a good, for me at least, a litmus test of I don't know if I need to necessarily go a lot deeper than that. So if there's anything that's hiding in there that I can't quite uncover with this, for me, I tend to kind of leave it alone. Maybe in select cases, I might try to get a lacrosse ball in there. In that case, I might put it against the wall. I might try and do it standing, just because it's a little hard to navigate on the mat or on the floor with such a small ball. But the lacrosse ball is also an option. I do see people use that sometimes. That can work out pretty well. Sometimes a lacrosse ball is actually a nice way to work out the deltoids, against the wall. Sometimes I'll see people do that, or I'll have somebody do that every now and then. But for the most part, when it comes to soft tissue type massage techniques, I'm usually using again these 3 items here. These are the main ones that I tend to use. I really don't take it much farther than that. Again, I've mentioned I don't really like these rumble rollers, or the ones that have these really aggressive knobs on them. I think that's more in the masochistic category. I do know people who seem to like those, but I don't know if I'd say I actually know a lot of people who like them and actually consistently use them for a long time, though. Although I assume those individuals may be out there. Sometimes too much of a good thing, though, as I've mentioned on this channel, can work against you. So I think these rolls are going to do a pretty good job in the soft tissue department. Anything that these aren't going to cover, then I'll typically actually just try to tell somebody to go to masseuse. Maybe a masseuse can help you work out some of those issues. And who doesn't like going to masseuse, right? So there's my 2 cents on kind of foam rolling in general. So now I'm just going to go ahead and summarize at the end here, kind of the theoretical basis for foam rolling, how it works, and who we think that maybe is going to be a good candidate for it. All right, so some of the main things we think foam rolling is beneficial for, tissue extensibility, elasticity, essentially, so increasing range of motion. There may be some inherent stiffness in our muscles for various reasons, It can be from, again, just prolonged, positioning in more contracted positions, like we might see with somebody in a hospital. Somebody who's laying in bed all the time, they may develop, what we call contractures. Somebody, though, who's just maybe exercising a lot. So if you're exercising, you're going to basically produce, exercise-induced muscle damage, and that creates a level of soreness, kind of joint stiffness sometimes if you're really sore. And so by rolling it, you can actually sometimes work out some of that soreness, that stiffness. And then sometimes we also have a phenomenon we call DOMS, delayed onset muscle soreness, which is sort of that soreness that follows maybe not necessarily immediately after workout, but within a few days. The inflammatory response, but you're getting at a low level after, because there is a stress and a trauma to a muscle when you're doing a lot of resistance training that maybe follows and peaks at around 72 hours. And so sometimes somebody might say, well, I wasn't that sore the next day after the workout, but then the day after that, I was really sore. And so sometimes getting on these rollers can really help work some of that out. And, that's nice from just kind of a pain reduction perspective, but it's also pretty helpful from a performance enhancement perspective, because if you're somebody who needs to get back to the gym, perform at a high level, but you're really sore, or maybe you're just feeling a little stiff, by rolling yourself out, you kind of prepare your tissue for that activity by loosening it up. And so you can increase, power output, force generation, things you're going to need to essentially do a better workout. And maybe actually, by having a better workout, again, that cumulative effect will snowball over time. And so within that one workout, you have a better session. But again, if you do that consistently, where you're, being able to iron out some of the stiffnesses you may have that follow workouts and things of that nature, so you're always having, better workouts, so to speak, because this doesn't necessarily seem to decrease performance the way that maybe static stretching does. So we think that static stretching, prolonged stretching, right before a workout may decrease performance. And that's why we typically tell people to do a more dynamic stretching and warm up before a workout, your static stretching after. But foam rolling doesn't actually seem to decrease performance. So the cool thing is you can do a bit of foam rolling. I wouldn't go to town on it for like 20 minutes, but if you do, 5-10 minute foam rolling session, pretty much like what I've shown in this video, once you get good at the stuff I've shown in this video, it really shouldn't take you that long to run through these rolls. And once you've done it a few times, you might even be able to skip certain positions because you just know that's not really a roll that gives me any trouble at all. I can just kind of briefly run through that, or maybe skip it, and then just kind of hone in on the areas where I'm having stiffness. So if I'm doing squats or deadlifts, I have a lot of tension in my hips, my low back. Maybe I want to work that out before I do those exercises, so that way I can do those exercises more effectively. That's where I really think the foam roller shines, and that's pretty much how I program it for a more athletic population. Now, if somebody has a lot of pain, that really depends on what kind of pain they're having and where the pain is. In certain cases, I do think that this is applicable and could work for somebody, maybe purely from a pain perspective, but I don't necessarily know that I would broadly say foam rolling is going to be the best go-to for everybody, because one of the precursors is it does take a certain amount of strength to kind of move in and out of some of these positions. Now, that being said, everyone I think should be able to build up hopefully to that level, or at least approach that level. But if I'm getting somebody who's very low level, there's somebody who's only walking 150 feet and they couldn't get themselves up off the floor to save their life, well, that person, I'm not necessarily going to say, well, let's get down on the floor and do a whole bunch of foam rolling. I might try to find some other methods to get that person the pain relief that they need, probably more by doing exercise and things of that nature. But if somebody's already doing those exercises and they're somewhat strong and they want a little more icing on the cake, they want a little more relief, foam rolling sometimes can get that for them. So that's kind of my 2 cents on foam rolling, who I use it for. Performance enhancement, I think it's a pretty decent one. It's not going to be a deal breaker. Obviously, people have built up great physiques and they've done very well for themselves that probably never touched a foam roll. But I would say that maybe if you had that individual use a foam roll, maybe they could have been even better. So that's kind of the old, the thing we'll never know, right? We don't have evidence of that counterfactual, as they say. I've gotten myself to a point where I've kind of, gotten that maintenance mode, as I call it. So I'll kind of check in with the roller. Sometimes I might even do it as infrequently as like once a week. If I'm really, not very good, I'll sometimes even go once every 2 weeks. I try not to push it out too much more than that, because typically if I do it too long, I can already notice I do have a little more tension on those IT bands and things of that nature. But as long as I'm doing it like once a week, I typically feel pretty good. But again, maybe if I had a really tough workout and my hips are feeling stiff, and then I'm trying to come back to another exercise where I'm going to try to be moving into some ranges that I know are going to be difficult for me, I'll definitely try to jump on the roller and iron those things out. And that's how I've had some pretty good results with it. So once again, that's foam rolling 101. Hopefully this video did a little more justice than the first one. Feel free to check out the first one if you want to attend yourself. Let me know what you guys think. You guys can definitely leave some comments below. Any other roles I didn't discuss in this video, any other topics related to foam rolling you want to see, or maybe even just talk about a different foam rolling product. I didn't talk about the ones that vibrate, and that's kind of a bit of a hot topic, or at least it was a few years ago with all the different guns, hypervolts, and then they have these vibrating rollers now. That is probably icing on the cake at best. I'll just say for now, it may help a little bit more with pain relief, but how much more benefit you're getting by that extra vibration, I would say it's probably pretty marginal. And for the extra costs, because the costs are exponentially higher with a lot of those than some of these, more minimal products, for me, it doesn't really justify it. But maybe I'll revisit that at some point later, and I'll do a video on sort of those vibrating rollers and trigger point guns and all those types of things. But for now, just the basics. And so that's the video for today. Definitely comment below and let me know what you guys think. Good stuff in the pipeline. And as always, I hope you guys have some fun.